Greetings. Hello, everyone. I'm Ben Perham, an Education Assistant at the Northeast Resource Recovery Association. I want to warmly welcome you to our summer webinar series. Today, we explore medical waste disposal in needles, pharmaceuticals, vaping, and more. Next slide, please. Do you need professional credits? You can receive 1 hour professional development credit by participating in a live webinar and completing the short survey at the end. Our webinars are being recorded and will be made available for those who registered. Continue your learning with these webinars all summer long. Please visit our new website at nrrarecycles.org for additional information. Next slide, please. Here's some information on our webinars. For recycling facility operators, we have our operator track webinars from which to choose from. Next slide. And for our educators, administrators, and community members, we have our community track webinars. We've separated our webinars according to probable interest groups, but all our NRRA members and not yet members are welcome to participate in any and all of the webinar offerings. Next slide. I'd like to set the table for this go-to webinar. Webinar participants will not be able to be heard by the presenters or other participants during this presentation. If you cannot hear the presenters' voices, please click the audio arrow in your control panel and choose computer audio. If that does not work, select the phone call option and follow the directions. We hope you will ask questions and our presenters will do their best to answer them as time allows. Click on the question block in the control panel and type in your questions. Please keep questions short and to the point. I would also like to bring your attention to the handouts for this webinar. They can also be found in the control console. You are welcome to view, download, or both. Next slide, please. Here's some information about the Northeast Resource Recovery Association. We're a recycling nonprofit. We have 400 members, primarily municipalities, and we were founded nearly 40 years ago. Next slide. So what do? We do cooperative marketing and purchasing. We enable communities to manage their own recycling programs and offer over 40 programs, including single stream and municipal solid waste. We connect sellers of recyclables to purchasers. Next slide. We provide education and technical assistance through workshops, facility tours, an annual conference, a school club, and of course, these summer webinars. Next slide. Here's some information about the Lakes Region Planning Commission that has helped in the preparation and planning of this webinar presentation today. The Lakes Region Planning Commission is a nonprofit association of local governments that provides comprehensive planning services to meet the diverse needs of New Hampshire's Lakes region. The LRPC works with town select boards, municipal committees, regional commissioners, economic development councils, and state officials to research planning issues and recommend next steps in local projects. They offer grant writing and administrative services to help with planning for economic development projects, household hazardous waste collections, land use and housing, hazard mitigation planning, natural resource conservation, and solid waste management. Next slide. This map shows the 30 municipalities that make up the Lakes region of New Hampshire, 29 of which are the LRPC and have access to their services. Next slide. And now I would like to introduce our lead presenter today, along with two guests. I will be joining in on the discussion as one of the guest speakers, and so will Paige Wilson. Paige Wilson is the solid waste planner and assistant grant administrator for the Lakes Region Planning Commission located in Meredith, New Hampshire. She recently completed her master's degree in environmental science and policy at Plymouth State University, where she studied composting for the purpose of helping New Hampshire's Department of Environmental Services update New Hampshire's compost regulations. She joined us in Plymouth, New Hampshire this past February when we presented our medical waste disposal roundtable. Our featured presenter for today will be Cindy Sterling. Cindy joined the NRRA after years of service as an educator, grant writer, and programs coordinator at the Windham Solid Waste Management District in Vermont. Prior to working in Vermont, she was a senior solid waste specialist for the Rural Community Assistance Partnership, a national organization based out of Washington, D.C. Thank you for being with us today, Cindy and Paige. On behalf of the NRRA, I'd like to welcome you to the summer webinar series and turn this presentation over to you.
Great. Thanks, Ben. Good afternoon, everyone. So I just want to give you a brief overview of NRRA's PRAPS project. It stands for Promoting Recycling at Public Spaces and Events. PRAPS, we can do better. The purpose of this grant project was to use public spaces to provide the necessary education and support to promote and improve recycling and waste reduction at special events. This included continuing NRRA's indoor air quality and STAR of sustainability assessments in schools, boosting e-waste and battery collections, strengthening the processed glass aggregate program industry, as well as the reuse of glass for new cullet and fiberglass installation, and, why we're here today, reinforcing local prescription drug and used needle collection programs communication. So today we are reporting on the progress to date regarding that medical waste portion of PRAPS, which does include batteries, because we found out that medical waste devices do have batteries in them, pharmaceuticals, needles, and so much more, as we learned in our roundtables. So when I say roundtables, this entire project started with designing and scheduling 6 roundtables. There were 2 in each of the targeted states, Massachusetts, New Hampshire, and Vermont. And these roundtables were to gather information, increase stakeholder communication, and determine what projects could be implemented to make a difference. Most importantly, as we were gathering together in the roundtables, it was a means to collaborate and make the most of the allotted grant funds. In February, as Ben mentioned, we held our first roundtable in Plymouth, New Hampshire. It was inspirational, and we joined forces with Lakes Region Planning Commission, and that is why we are together again today. We're bringing it around full circle. So I'm so happy that Paige is joining us today for our webinar. But coronavirus, yes, that pandemic, it altered our platform. Everything we had planned up till February was changed, transformed, and it started with converting the next scheduled roundtable to a webinar to discuss COVID-19 best management practices for the recycling facilities. We found that over 300 people participated in this very informative webinar. So NRRA has kept it up on their website. It is recorded, it is available. And if you're interested in it and learning more about this particular topic, you can hear what Reagan Bissonette, our executive director, and Bonnie Bethune, NRRA's member services manager. And then we had a guest expert of infectious disease epidemiology, Dr. Ben Lachlan. So they all joined together, and it was a bang up event. It was great. We could never get 300 people at a round table. So it definitely proved that switching over to remote is possible during our COVID-19 lives. And so just again, not to belabor COVID-19, we're moving on from it, but in the beginning, you know, we were looking at what is the medical waste regulations as directed by the Occupational Safety and Health Act of 1970. Really not much has changed. You would manage it like any other regulated medical waste, use typical engineering, administrative controls, safe work practices, and PPE, such as your puncture-resistant gloves and face and eye protection. So really, the guidelines didn't change for those managing medical waste, whether you're in an institution like a hospital or a nursing home or wherever else, you know, you're still using all the protection and the regulations that you always knew to use. And so those OSHA guidelines, we do have them on our resource page as part of the handout. They are constantly updating their website. We also looked at what CDC had been giving out for guidance documents. Again, the Center for Disease Control and Prevention. same thing. Whatever you've been doing with medical waste management, it really hasn't changed. What we added here, though, which we found was very interesting and a much needed information, and still continues on, that people need to remember that the virus is airborne for 3 hours. Surface areas, and again, we were looking at people that handle the waste at transfer stations and whatnot. So 4 hours on copper, 24 hours on cardboard, 72 hours on stainless steel, and plastic 72 hours. As we know to date, there have not been many situations where people have been inoculated by surface, and it's all pretty much still airborne. And so we just really need to consider that. And basically the takeaway from all of this is that medical waste and trash coming from any healthcare facility treating COVID-19, COVID-19, there's no different than any waste coming from facilities without the COVID-19 patients. There is no evidence to suggest that facility waste needs any additional disinfection, and that is from the CDC. And if we want to address how you're collecting it or recycling any of this waste, it's what we're still practicing. We're practicing the distance, the physical distance of 6 feet, keep that going, wear your cloth face coverings, routinely clean and disinfect your frequently touched surfaces, the steering wheels, door handles, levels, control panels, right? We just have to continue to remind ourselves as this is going on and on and on. And I know some people get tired of it all and they wish it would go away, but it's not going away. So we just need to continue those initial practices. And, you know, wear your personal protective equipment. If any of that is ripped or torn, of course, you're going to take it off and replace it. So summary being that not a lot has changed with regards to management of medical waste or personal protection than what you already know in your present industry that you're working in. There is a big change, though, in our traffic patterns and time management and the services that we can offer, and also the difficulty, which I am finding out, of being heard or understood while wearing a mask. Plus, we've seen an increase in the use and disposal of masks and gloves. And that's why I put a few pictures of how the masks are becoming a common litter problem. I don't know if people think that they're like cigarette butts and you can just throw them anywhere, but we would really like to let people know to throw those masks away, and no, you cannot recycle those masks if they're made out of an oil foundation. You know, if they're not cloth, a natural material, then they do need to be thrown away in the trash with your gloves. So just taking a second and bringing back the fact that we do have our question panel, and this is a nice opportunity to practice using the question panel. If you have any additional questions regarding COVID-19, we belabored the COVID-19 situation throughout all the roundtables, and we just wanted to bring back a quick summary of it for this webinar. Also want to mention that following that April 15th roundtable webinar that we did on the coronavirus, a bunch of questions came up that we were unable to answer during the actual webinar. And so we took the time to list all those questions and to post them on our website. And we want to follow that same pattern in today's webinar. So as we're going through it, if you have questions and we were not able to get to them or we're unable to answer them, because this grant goes until September 30th. And today is just an accumulation, like a summary of what we learned during the roundtables to this point. And so we are still doing research, and we still have projects out there that we want to support having to do with best management practices for medical waste. What is medical waste? Quickly, when I say medical waste, I'm talking about all of these: biomedical, clinical, biohazardous, regulated, infectious, and healthcare waste. We developed this list here, who handles medical waste, and it highlights the variety of attendees. Those are the ones that are in yellow, that came to our roundtables, which eventually morphed into remote roundtables due to the COVID-19 policies. So we continued with our roundtable plans. We just had to do them remotely through GoToMeeting. Lots of representation. It was actually wonderful. We had the 4 remote roundtables. They were held in April, May, and June. And then we followed up with cold call surveys in July for people that did not attend the roundtables. So as you can see, those that attended, and then we still have a few blank spots here where, as much as we reached out, we still could not get representation from any of those sectors. Now, Ben, we took a poll in the beginning of our survey. Do you want to launch that? Those responses, excellent. So for today, are you associated with any of these medical waste handlers? We have some that are associated with laboratories and research centers, and others with blood banks. We would love to hear more from you. And like I said, this is not over yet. It goes until September 30th, our research and work in medical waste with the Lakes Region Planning Commission. And we, if you can, I guess we'll know who those people are that answered that, because we still want to know what's happening. So you can use the question section here as also putting comments in. You don't necessarily have to ask a question. You can always just throw out comments. And that was the beauty of the medical waste roundtables, because they were set up through GoToMeeting. And so there was a lot more interaction between the participants and us than we get with a webinar format. I'm just going to throw it out there to Ben or Paige to see if there's anything that I've missed regarding this very important slide of who handles medical waste.
No, I think you covered it pretty good.
Yeah, from my
Okay.
perspective, I think you covered it, Cindy, well. Thank you.
Okay, great, thank you. So I gotta go back to this. Okay, so what is medical waste? Another exciting part of our roundtables and our research to this point is, when we started off, I was like, okay, these are the categories identified by the World Health Organization. These are the ones that we identify in the field, right? Sort of like the common language versus the more technical language. And I am really happy to say that we actually covered all of this information. We actually ended up adding to our categories identified in the field near the end. Vape products, inhalers, and Epipens. And pretty much all the categories. I would say the only ones that we really didn't hear from yet, so please, if you have any information, not that it came up, so maybe we don't need to worry about it, but the pathological waste, which is actually your human or animal body parts, organs, tissues, surgical specimens, and then genotoxic was another one that we didn't have a lot of discussion around. And that's, chemical or any other agent that damages your cellular DNA, which would result in mutations or cancer. Now, we did get some questions from our roundtable folks regarding cancer, animals that had cancer and how it resulted, like, does it affect the kitty litter box if they're taking these cancer medications, and how does that affect disposal of it? What we discovered through that particular question was it really has to do with trace amounts. But we are still doing research, still looking for more information. And if we didn't answer that question well enough, then we will continue to work on finding what would be a better answer if the trace amounts does not seem to settle it for everyone. But let's move on to our 3 beautiful new ones that we were so excited to start discussing with everyone that joined in on the roundtables. And Ben, I'll leave that to you.
Great. Thank you, Cindy, for that segue into this. Now, there were three items that came up during the roundtables that we really hadn't targeted, but we did learn more about them. And I'll just go through what we kind of found. The first had to do with vaping and e-cigarettes. And so let me give you a little background here for those who aren't quite sure. But e-cigarettes is a catch-all phrase for the different electronic devices used for vaping. These electronic devices can take on a number of different appearances and names. Some look like regular cigarettes. Others may have more of a pipe-like appearance, or even like a small box that would fit conveniently in your hand with a stem popping out of it. There are a variety of names as well for e-cigarettes. There are vapes, vape pens, vape boxes, tank systems, e-hookahs, mechanical mods, e-cigars, and Juul, just to name a few. Some e-cigarettes are disposable, and some have rechargeable batteries and replaceable e-cartridges. Vaping derived its name because of the aerosol cloud given off during use. The cloud is created when a battery-powered e-cigarette heats the liquid into an aerosol that the user inhales. So, with e-cigarettes, we have batteries used to heat liquid chemical substances. Most likely the substance is nicotine, which we all recognize as a very common drug. Now, this Vape-Aware slide that I have up here is from Boulder County, Colorado, who have the Vape-Aware program. And I thought they did a great job of pointing out the basics to the problems that e-cigarettes can cause, in addition to the manner in which they should be disposed of. As with the case of batteries, which e-cigarettes contain, vape batteries can start landfill fires. They should be recycled. The e-liquid that is contained in the bottles, refillable cartridges, tanks, and pods could leak into the ground, introducing hazardous chemicals into the environment, not to mention the deadly consequences that could occur if they get into the hands of children or in the mouths of pets. The e-liquid items should be disposed of as hazardous waste. So Cindy, if you can move to the next slide there. Yeah, we can take a look at some of these different vaping devices, and these more look like the traditional cigarette, I guess, but some of them are quite different looking. And when you look through these, you can see the picture in the bottom left-hand corner. Those are actually some vaping devices, and you can see the nicotine liquid in the little capsule there, and then other components, batteries, and so forth. So, and there's also refill liquids for these devices. You can see in the Vape-Aware image there. So, bottom line is that vaping is a common example of drug use that requires hazardous materials disposal outcome. One worthy note that we discovered is effective October 2019, the DEA National Drug Take Back Day added the take back of vaping cigarettes and cartridges to their list of acceptable items. So there is a means to dispose of the actual devices properly without the battery at DEA days. So moving on to the next slide there, Cindy. We also looked at another item came up for us there at the roundtables, and that was inhalers. There was a good MedPro Disposal website article that I looked at on inhalers, and in that article, the FDA cautions us that inhalers can be dangerous if punctured or thrown into an incinerator. We are reminded not to discard of them in the regular trash. They shouldn't be disposed of in that manner because, as cited in the article, GlaxoSmithKline, a major pharmaceutical company, did a study that showed 29% of inhalers disposed of have leftover medication. And of course, this leftover medication, if it ends up in a landfill, could contaminate groundwater. Also, the cartridges themselves, if compacted or left to sit around in a garbage truck for too long on, say, a nice August afternoon, could explode. It was also mentioned that some inhalers, when broken down, will release greenhouse gases. The article further explained that inhaler-related greenhouse gases may be responsible for about 5 million tons of CO2 emissions across the world. Bottom line, inhalers don't belong in the regular trash. They don't belong in pharmaceutical disposal boxes or sharps containers. Inhalers are considered hazardous waste, and in this MedPro article, they recommend giving them back to your local pharmacy. As part of my research, I did check it out in Walgreens, which is in many of our communities, have certain stores throughout New Hampshire, Mass, and Vermont that offer a kiosk where you can drop off your inhaler as well as other prescription drugs. So there is an option with Walgreens. Check it out online. The third item that we came across, yeah, go ahead and move on there, Cindy, were Epipens. Epipens are used to administer medication, epinephrine, in emergencies to treat very serious allergic reactions caused by insect stings, bites, food, drugs, and other substances. The EpiPen website recommends that EpiPens should be taken to a healthcare professional's office or to a hospital for proper disposal. In a Consumer Reports article, people were cautioned against disposal in household trash due to needle pricks. They recommended that a patient give them to the healthcare professional that they visit after they use them, which makes sense. They also recommended in this article taking expired pens to a doctor's office or hospital or pharmacy. Another viable option would be dispose of them as you would with sharps, other sharps, which we'll be addressing in a little bit. So those were 3 additional medical disposal items that we came up with the roundtables. And I think we got a lot of good information on them, but we're looking for even more to proceed further. So Cindy, I'll throw it back to you.
All right, so the health risks, and the reason I put up the thermometer on the left and then the needle on the right is because in 1998, when we started really looking at medical waste focus, I mean, back then people were still just throwing it down the toilets and, you know, maybe bringing something to the hazmat days, but really we were looking at mercury containing devices. And so that would be like your manometers, which, you know, check your blood pressure, thermometers, of course, and, you know, thermostats in people's homes. And then there's also compact fluorescent bulbs. But at that time, we organized, and when I say we, it was state and federal governments were encouraging consumers to consider alternatives to the products that contain mercury, and there was actually funding provided to do thermometer exchange programs. So, and also to collect thermostats and manometers to keep them out of being thrown away, out of the disposal line. And so, you know, time has passed, and I actually attached as a handout the Clean Water Act section that talks about what New England states and New York did as aggressive actions to actually say that no product could be sold in these states unless they had proper labeling concerning the contents as well as proper disposal. So I bring this up today only because it's a similar campaign that we discovered is needed for needles, right? So the health risks today are basically what's driving people are the needles that we find everywhere, right? So if you're working in the solid waste industry, you have to be really worried about getting pricked by a needle. That, you know, you can just throw it away in the trash, not really. We like it to be contained, and Paige will talk about all of that disposal procedures for that. But just our health risks have shifted, you know, like people just like they're throwing away masks and littering them on the ground. The discovery of used needles, sadly, is being found in public spaces. So that is why I put together that whole exchange of the mercury-containing devices with exchange of needles. And in our roundtable, we discovered this beautiful, simple answer, which is just these needle clippers. I had never heard of them. Somebody in the Plymouth Roundtable had mentioned this, and we all started Googling it. And the needle clipper is great. If we can figure out a way to get more of these needle clippers to the hands of the public, they're not that expensive. They're like $3 a piece. And I sort of see this as, you know, our mercury-containing devices was during the first decade of the 21st century, and now we need to promote and put that same kind of energy into needle clippers for this second decade of the 21st century. And I just want to throw it out there. I want to also be mindful of time, but Ben or Paige, do you have anything else that you would like to say about needle clippers right now?
Yeah, Cindy, I'll speak to that a little bit. When I went out looking for needle clippers at retail stores, I was unable to find them. I ended up going to a pharmacist and having them look through their order catalog, and they managed to find the needle clippers, and they did order them for me. So I was able to get it that way, and I think retail price on them was about $5, but they're the coolest thing. I love that we didn't discover it, but that we found it as part of this process, in that you know, you can put over 1,500 needles, syringe needles, into one of these clippers, and then you can dispose of it with your other sharps. So you just take that clipper, you tape it, and you drop it into your sharps container, and you know, you're getting rid of 1,500 needles at a time. So I just thought it was a wonderful resource that's not readily available out there in a retail setting, mostly due to shelf movement requirements, as far as we could tell. They just don't move off the shelf fast enough, so it's not worth it to the store to keep it on hand all the time. But they were happy to order it when I did ask them about it. So
Yeah, and they fit in your pocket, so it makes managing your needles so much easier. And then when you throw away the needle, what's left, right, the harmful piece is in that clipper, which then you can dispose of by taping it and throwing it in your regular trash. But it stops that needles just being tossed everywhere in trash cans and public spaces, bathrooms. Yeah, so this is definitely something that we're excited about, and we're going to figure out how to put this into action as an exchange program if possible. So let's move on to what are the disposal options. And Ben, again, in the beginning, we had a little bit of no, you're going to launch another poll regarding disposal options.
I'll send it right out now.
Okay, so Ben's going to send out another little poll, but we're going to move on. And that is the poll. So go ahead and answer it, send it back. But meanwhile, while we're waiting, we will get Paige in on this discussion regarding the disposal options. So take it away, Paige.
Yeah, so pretty much disposal options for sharps and unused medications vary by state, but also by town, just depending on the regulations and the facility capabilities in your community. So from our research, we did find that expired or unused medicine can be disposed of through the DEA National Drug Take Back Days that happen in the spring and fall. This is a free and anonymous program option, and the next one is scheduled for October 24th of this year. The one in April did get canceled because of COVID, but I think that they might have some different guidelines for what's coming up in the fall. A lot of local police departments tend to be a part of this event, and the DEA website has a list of all the drop-off locations that are part of this program. And some departments even take it a step further, and they have a year-round drop-off option in their building, and it is also free and anonymous. Excuse me. For sharps, some transfer stations and trash collectors will take them as long as they are separate from the rest of your trash and labeled correctly. I have an image of what one of those bottles look like on the next slide. But some clinics and hospitals also have take back or exchange programs. It's just important to kind of check with your facility first before bringing them there. And they might, if they don't take them, they might be able to direct you to another option. Some household hazardous waste collections accept medical waste, but again, just checking with your local program. Some don't always take them. Excuse me. I do know that the one in the Lakes region, unfortunately, we don't take medicine and sharps, but we do offer brochures and other resources for safe disposal. But maybe it will be something we'll start accepting in the future. But some incinerators will also take medical waste as long as they are meeting certain temperature requirements and they are fitted with the right equipment. There are incinerators that we have been in contact with in Bridgewater, and also the one in Pennacook will take medical waste. But there have been some instances where inhalers and batteries have gotten into the mix, and that obviously causes some problems. And then last on this slide is just that there are some mail back programs for folks to purchase sharps and medicine bins, and then you can mail them back for safe disposal through some of these companies like Stericycle, Safe Needle Disposal, and MedWaste. Next slide. So like I mentioned, transfer stations may ask the residents to just separate the sharps from the regular trash. You can put them in a rigid plastic container like a laundry detergent bottle and then tape it shut and just put a label on it that says sharps do not recycle and label it around all the sides. And just like this picture on the right shows from the DES website. So after that, yeah, I've kind of found that facilities tend to put them in the trash compactor once they have about half a dozen containers or so. And just from doing some basic research around the Lakes region, I put myself in the role of a resident trying to find some disposal information on my town website. And I found that 6 out of the 30 communities had sharps disposal information available. 4 out of the 30 had medicine disposal information, and then six of them did say that they offered safe sharps disposal at their facility. So more transfer stations may offer this as an option if it's separate from their regular trash, but it wasn't clearly stated on a lot of the town web pages. So in terms of next steps, that might be something I personally will pursue, is trying to get communities to kind of bridge the gap and offer some more information for their residents. But here are some examples of a few communities that had some really good information. The one on the top left is from Moultonboro. That was something that they had kind of created for a resource for their residents. The one on the bottom right was from Holderness, and they just had a link to the DES Household Sharps informational flyer. And then the one on the right was kind of the most extensive one that I found, so I wanted to give a shout out to Effingham because they actually had a really good list of resources available for both medications and needle disposal. Next slide. So pills, liquid, and patches can actually go into these DETERA dissolve packets for easy medicine and opioid disposal. So these, the contents within these packets actually help to neutralize the medicine that you put in it, so it can just be disposed of with your trash. So this is a really easy option, but if you don't have access to these pouches, you can also put medicine in with a bag of some cat litter or some used coffee grounds, even dirt, and you can also put some in latex paint and let it harden. So although these might not be some most favorable methods, it is an option to just try and ease some of the impacts that medical waste has on the waste stream. Next slide, please. So in general, just to throw some data up about the DEA Take Back Day and whether it's making an impact. So between a 3-year time period, there's been an overall increase in law enforcement participation, the number of collection sites available, and the total weight that's being collected. So there are historic data sets and maps available on their website if you're interested in looking at their historic Take Back Day program results. So the Lakes Region Household Hazardous Product Facility in Wolfboro hosts 4 medicine collections each year. And these 2 graphs just show the household participation and the gallons of medicine that is collected each year between 2006 and this year, 2020. And they have only completed about 2 out of the 4 collections this year. The next one is actually tomorrow. So we just missed the results for that one, but I'm sure it will be a good success. And since the first collections, there's been a general overall increase in the amount of medicine coming in each year, and the participation has generally correlated with that. There is kind of an exception within the last 4 years. Participation seemed to decrease, but the volume coming in was still relatively high. So, these increases could be a result from outreach and education at a local level from the facility, local clinics and hospitals, but also from the DEA's efforts for marketing and creating a lot of PSAs about the risks associated with keeping medicine in the household. So all around good outreach, and seems like people are getting the point. So other than disposal expenses, there are also costs associated with increased healthcare for drug overdoses and substance misuse. And there's also impacts on our criminal justice system where, there's been a lot more work dedicated to trying to control our opioid crisis. In addition, there's negative impacts on overall productivity, where if someone may be misusing their medications, it can certainly affect how they function in the workplace and how they are operating at their jobs and just day-to-day life. There's some negative impacts on the environment, which we've kind of touched on a little bit. So if people tend to flush their medications down the drain, it ends up in our wastewater treatment plants, and they might not have the full technology to completely treat what's in the water, and then it ends up in our waterways, our soil, and it can negatively impact aquatic organisms as well. We even heard of some cases where people were flushing their sharps down the toilet, which can obviously cause some problems for septic systems.
Yeah, Paige, if I can just interject real quick, I was looking at some costs that are attributable to the non-medical use of prescription opioids. And back in 2001, it was up to $8.6 billion. In 2006, we were looking at 53.4, and now in 2020, we're up to $78.5 billion of costs attributed to non-medical use of prescription drugs. If you look at some of the costs associated with some options, pay to play, if you will, or pay to throw options that are available and safe to use to dispose of your medical, different medical wastes, we see that the sharps disposal by mail can be anywhere from $4 to $115. With biohazard bags, we're looking at $8 to $200. And with pharmaceutical waste containers, anywhere from $15 to $340. And with that being said, I know that you looked into some costs associated with the correctional facility in New Hampshire. If you wanted to chime in with those now, Paige.
Yeah, so I found the 2018 annual report from the New Hampshire Department of Correctional Facilities. They have a bunch of reports, but this was actually the most recent one that they had published. So basically these graphs show the major expenses for the year. And you can see that medical and dental was the second largest expense, coming in just below $14 million. And with a population of about 2,700 people in our correctional facilities, that comes out to just a little over $5,100 per person for costs throughout the year. And obviously that can vary per person, but that was just our general calculation. So, and their pharmacy processes over 200,000 prescriptions each year. And the table on the right-hand side just gives a breakdown of those prescription needs. So really just overall, there's a lot of medications moving through this one part of the larger system. I just wanted to point that out. Next slide. So these tables, again, are just from that same report. It shows the medical costs based on different age groups, which is just kind of interesting. And I noticed that folks in their 30s, although they tend to rack up the most expenses and had the most number of patients, the average cost per person was actually higher for those over the age of 60. And the bottom table just highlights the pharmaceutical costs associated with different clinical needs. It just really goes to show how expensive these treatments really are. So just wanted to kind of highlight that. Next slide. So what are the guidelines? We always have to follow rules and regulations. So the DEA website really has some extensive information about proper disposal. And then the Controlled Drug Act outlines regulations in New Hampshire related to drug abuse treatment, reporting requirements, disposal methods for different agencies. It's really like the most comprehensive list of rules for drug handling. And for law enforcement agencies that may want to become a DEA host site, there are 3 contacts listed here for Massachusetts, New Hampshire, and Vermont. And I also listed the Chapter 318-E rules for participating in a drug take-back program. And then just below, there may be some OSHA and HIPAA compliance rules for different agencies, so it's just good to consider those and think about how you may fall under those categories. Next slide.
Yeah, I guess I'll jump in here, Paige, and speak to some of these slides as we go. Some information that I looked into as part of this process. One of the best sites that I found was safeneedledisposal.org, and you can see the directives there for sharps disposal in Vermont and New Hampshire. The directive, as we've talked about a little bit today, would be to place the sharps into a rugged container and tape the top securely shut, label it "Do Not Recycle," and place it with your curbside trash. Now in Massachusetts, with safeneedledisposal.org, you follow the same process. You'd put those sharps into that rugged container, you'd tape the top of it, you'd label it appropriately with "Do Not Recycle," but you're not allowed to put it in your trash. At that point, you can go onto the site and determine a drop-off place to bring your container, or you can take one of the other options. And if you go to the next slide there, they offered a few different options for Sharps mailback services: Metasend, Stericycle, and Sharps Compliances Incorporated. Next slide there. Yeah, so here's a couple examples of an appropriate sharp container. The one on the top there is just another laundry detergent bottle. It's not rocket science, but it's quite effective. They're strong and sturdy. You put those sharps in there and you screw the cap on and tape it down, and then you label it appropriately. And then you're good to go with New Hampshire and Vermont. And it's also just a mindful way to keep perhaps sharps in the house safely away from yourself and anyone else that might get into it. So moving on to the next slide. This was a brochure that was put out by Concord Hospital, Bureau of Student Wellness at educationnewhampshire.gov, and the New Hampshire School Nurses Association. At one of our roundtables, we did have a couple New Hampshire school nurses, and they were happy to provide this information. I thought this was very good information to have, just pointing out to parents and guardians of students, 99% of drug exposures reported annually to poison control centers happen in the home. You need to dispose of your unused medications properly. In this handout, they talked about the doTERRA pouches, which we've seen before. They talked about police station drop boxes, and then other drop boxes as well. Dispose of as directed on your prescription bottles, so you can find that directive. And then another one, of course, was to take your medication and to put it into a container that contains coffee grounds or some unappealing substance and put it in there and seal it properly and put it in your trash. And the last thing they mentioned here was educate your children. So moving on here, yeah, go ahead. Yeah, moving on, here's another brochure that the North Country Council was good enough to have access out there to, just disposing of medications and then different drop-offs for sharps and medications in the North Country of New Hampshire. Next slide. Then we heard from Vermont as well. This is a Windham County Solid Waste Management District brochure, disposal tips of healthcare products. Next slide. This is a website that I accessed in Vermont, 211 Vermont. Excellent access, and you can see with the screenshot there, needle exchange, medication, sharps disposal. There's options right there for medication disposal, needle exchange, and sharps disposal right there on the website, and they offer up good options in a number of them. Next slide, please. Another great option in Vermont has to do with the Vermont Department of Health website, where they have excellent access to information about safe needle disposal, as well as some materials that you can order for safe needle disposal, including that little nice little sticker there for warning syringes do not recycle. So you can put it on your laundry detergent bottle, put your syringes in there, and safely dispose of them properly in Vermont. So move on to the next slide, please. So what are the next steps? What do you think, Cindy?
Well, you know, we really, I'm still into those needle clippers, and the idea that we get more of those out there, and that's what we started doing with some of our roundtables, finding out what is the need from this particular roundtable. And so we did order some of the needle clippers, and we sent them up to the North Country, and they distributed them at some of their HHW days in specific towns as a pilot to see how that went. And then we also heard from some of the recovery centers and how they would really like to get more involved in people buy a bunch of needles or they're prescribed needles for whatever reason, but then they don't use them. And so a needle exchange program could really use them. So again, rather than like, I just throw away these perfectly good needles, bring them to a recovery center so they can implement it into a needle exchange program. So for me, I'm really looking at, you know, we really need to expand that public outreach and education, just like with the mercury containing devices. When the states were behind that, local and state government, there was funding available for it. And thank you, USDA, for giving us the funding to be able to, you know, make this way, because there's so much more that needs to be done. Just really like get that into the hands. Like, why not, when you order your needles as a diabetic or whatever from the pharmacy, then you should automatically have a needle clip that's somehow provided to you, maybe at a discount rate, or just so it's known about. We spoke to a pharmacist who said they keep them in the back, like you found, Ben. You know, you couldn't find it on the shelf, but because it's not a big seller, so it takes up shelf space, and so it's in the back, so you need to ask about it. So again, that education, that public outreach, funding, you know, you'd love to hear still from more pharmacies and whatnot to know what people are doing with these. And same with those medical packets that deactivate the medicine, the patches, the liquid medicine. Ben, you know, you received some when there was a situation that they gave you medicine and they gave you that packet. That's what I'm looking for. That's what I see is the big next step. Anybody else?
Yeah, so I'm happy to say that the Lakes Region Planning Commission did receive another USDA solid waste grant for next year. So we will be continuing our work and our research with helping to promote proper sharps and drug disposal. And just from our first roundtable in February, we connected with the Chief of Police in Ashland, who is interested in setting up a permanent drug drop box in their lobby, but since it's not open 24/7, they're having some trouble with meeting the guidelines. So I hope to work with them to try to see if there's any way to kind of get around that. And just wanted to note that in the handouts section, I found the Lakes Region Partnership for Public Health had put out a really great resource for police departments looking to become a Dropbox location. And it has a lot of good templates for letters that you might need to write to get approval for certain things, and outlines regulations and things of that nature. But overall, just helping with more research or outreach in the region, and trying to work with some of these towns that I find are not having a lot of information on their website. You know, if they have resources posted for other things, you know, maybe they can just make some space for something about sharps disposal. And I'll also be working with the product facility in Wolfboro to update a sharps brochure that we had found had some outdated information and resource links. But you know, other than that, if anybody has any other ideas, I'd really be great to work together and partner up to do something similar to what we did with NRRA for this series. So it's been a really great experience, but yeah.
Yeah, thanks, Paige.
Yeah.
And then Ben collected all these resources. And so, I mean, I guess we all collected them too, but Ben organized them for us. And so we have pages and pages of resources. They are a part of the handout section of this webinar. As you can see, they go from what the Northeast has, Lakes Region, Vermont Department of Health. We even have an ArcGIS mapping. It's very informative. The collection of the resources was probably one of the best parts as well to our medical waste partnership with the Lakes Region for this grant. And so we also have some great videos, so please check them out. Again, some of them were from the Health Vermont that you saw on that one slide. You can go to the website and get it. And the last one is one that was made with the Windham Solid Waste District. And, you know, was probably more than 10 years ago, but it's a quick PSA, and it's just a nice example of what can be produced for your area, your specific area, as Paige had mentioned, just letting, you know, giving the towns a little bit more assistance in highlighting what they're doing for medical waste and what their residents can do. That education and outreach. So our contact information is here. Again, thank you to USDA for funding this opportunity, because as I mentioned earlier, the funds need to come from somewhere so we can make the same type of strides we made with the mercury containing devices. And again, thank you for all the partners. And then Ben,
Yeah.
regarding the summer webinar series.
I just wanted to thank you and Paige on behalf of the NRRA. And being mindful of time, I do want to thank our sponsors as well. We'd like to thank Interstate Refrigerant Recovery Incorporated, Schnitzer, and the USDA. We would like to remind everyone to please take the post-webinar survey that will launch immediately after the webinar. It will also appear in your email box tomorrow. As a reminder, we always welcome feedback. Next slide. And please join us when our webinar summer series continues next Wednesday, August 26th, at a special Wednesday time of noon to 1, when Terry Goldberg, Executive Director of the Northeast Waste Management Officials Association, and Megan Pryor, Environmental Specialist, join us to discuss extended product responsibility. And then we'll be back Friday, August 28th, when Joe Witten, founder and CEO of Apparel Impact, will be with us to tell us why we need to think about clothing differently. Thank you all for attending, and have a happy summer.